My name is Joan Kheder. I'm a staff gastroenterologist here at MaineGeneral. Provide a wide range of gastrointestinal care as well as a procedure to our community here in Augusta. GERD is basically gastroesophageal reflux disease. That's when the content of the stomach come up to the esophagus, which can bother the patient, causing wide different of symptoms like heartburn, which is the most common ones. The other symptoms can be either chronic cough or sore throat. The basic treatment for GERD is antacids, which is commonly known as a proton pump inhibitor. There is other medication also called H2 blockers. Also, along with the lifestyle changes that the patient has to follow to prevent that acid reflux being a problem for them. You should talk about your doctor about GERD every time you have the symptoms. If you're complaining of acid reflux that's more than twice a week or even more frequently, you should talk to your doctor about it. The problem with acid reflux is not only bothersome for you immediately, but also there is a long-term consequences that can happen from acid reflux. For example, narrowing of the esophagus or stricture, or Barrett esophagus, which can be a precancerous condition. Beside the medical treatment that we discuss to treat acid reflux, there is also a wide variety of interventional procedure that's available right now. For example, we are bringing a new procedure to our community here in Maine that's first provided here at MaineGeneral Hospital, which is the TIF procedure. TIF procedure stands for transoral incisionless fundoplication, which is short for TIF. Basically meaning that we're trying to recreate the natural barrier that prevent or protect the esophagus from the acids, doing it endoscopically without any incision in the abdomen. So the whole procedure done through the endoscope, which is the camera go from the mouth down to the stomach. The benefit from doing the TIF is many less invasive than a surgery, so there is no incision happen in the abdomen because it's all done endoscopically. The other benefit is a quicker recovery time. Patients who underwent TIF have less complaint of dysphagia, which meaning trouble swallowing, belching, or even the ability of vomit, which some patients experience after surgery. The good candidate for TIF, basically a patient who suffer from acid reflux that's basically not controlled with the anti-acid medication and lifestyle changes, or even if it's controlled with those, but they don't want to be on medication for the rest of their life, TIF may be the good option for them. To know if you are a good candidate for a TIF procedure, you ask your primary care doctor to make a referral to gastroenterology. We will happy to review every patient case by case. Some patient will require extra testing to make sure the TIF procedure is a good option for them. Because even if not a good option, we can always refer the patient to other options that we provide here at MaineGeneral. The TIF procedure done endoscopically, as I mentioned before, take about 30 to 45 minutes. Patient will be sedated under anesthesia, so they don't remember anything. They stay in the hospital sometimes overnight for observation, and the diet will be progressed from a liquid diet originally, then slowly advanced to soft diet and then regular diet. Regarding the antacids, typically we keep the patient on antacids and then we wean them down gradually after that. Some people suffer or have a hiatal hernia. The TIF procedure still can help with that. If the hiatal hernia less than 2 centimeters, which is typically measured when the endoscopy done or through an x-ray, the TIF procedure is still a good option for the patient. But if the hiatal hernia more than 2 centimeters, only TIF will not help the patient. It should be combined with a surgical option, which is fixing the hiatal hernia. These two procedures can be done in the same day, so the patient will come to the hospital, have the hiatal hernia repaired, and at the same time when they are asleep, the TIF procedure will follow after that. And then they will get the benefit of fixing the hiatal hernia and the benefit of having a TIF done as well. A lot of patients benefit from the TIF procedure here at MaineGeneral, and the patient been having very good response, and they've been saying that it's a life-changing procedure for them. They were able to eat food they were not eating before, and obviously they're taking less medication than before. So if you have any problem with acid reflux, please talk to your primary care doctor, let them know about it, and we are here at MaineGeneral happy to help you with that.